Yesterday morning it was pointed out the importance of quickly sharing information or data on disease events or biothreat incidences, whether they're accidental, natural, or intentional, so that we could all be prepared, all be alerted, and take appropriate measures to prevent further incursion of these biothreats to our countries. So this we've been doing at the OIE through our information systems. That has, I'll show that how it has evolved over time from the 1927, 1924, up till now with the current WAHIS system. So we see this information, collection of information and dissemination of this information to our members and non-members as a public good. So I go into the green. Okay. But before, because I'm here to also inform you about the upgrading of WAHIS, I'll quickly take you through how WAHIS has actually, or our information systems have actually facilitated our members and as the OIE to collectively achieve our mandate of transparency. And then I'll show you why we need to upgrade the system and finish off by showing you exactly where we are at the moment. I've talked about the mandate, and since 1924, the inception of the OIE, and the reports that have been coming since 1924, our mission at the OIE was always to ensure transparency of animal health situation at global level. That is basically to ensure that the members have an obligation to report to the OIE the disease events that they recognize in the country, and within 24 hours at the OIE, we disseminate that information to our members to be able to be alerted and be prepared. And this is evolved from the 1924, from the founding 28 members to the current reporting 203 member countries and territories. This is over and above the 181 members that we have. We have 181 members, but non-members also see the reason to notify diseases to the OIE because of various reasons that I'll share with you in a moment. And these diseases evolved from 9 diseases in the 1924, 1927 to a current 116 OIE-listed diseases. These are not the only important diseases. It's the diseases that have met the criteria for notification to the OIE as the members have determined important to them. To say there are not only 8 important diseases. These are the diseases that meet the criteria for us regarding trade, international trade. Sharing of information is important to meet the objectives, as I said, of transparency, being alerted, being prepared. And it also for us to manage all these disease incidences. And over the years, the system has evolved. We've moved from the telegram. We've moved from the handy status, which is actually even currently active. We are maintaining this information, whereby information was taken from all, was received in all measures and formats except electronic, and it was entered to a system, and that was made electronic to the members. And then in 2005, we realized this was cumbersome. We needed a more advanced system, and WAHIS was launched in 2005, where members enter the information, and the information is available. And in 2015, due to the demands of the members, we added a new feature into WAHIS, which was for data extraction. We call it the World Animal Health. It was originally a book that we converted into electronic format, and we did away with the book. And moving on with the times, as the entrepreneurs nowadays will say, if your idea doesn't work on the mobile phone, forget it. So we are saying we are moving on with the time to meet the demands of the society, where the information is demanded on the go. In 2016, in June, we launched in May, we launched the mobile application, where alerts are received as they are sent out. And in this year, we collaborated with one of the OIE reference centers to develop the e-learning platform, where the members, even non-members, can actually undertake training online this is the idea to improve transparency and improve disease reporting and collection of information by the OIE. All the target is to improve transparency, have the efficiency and the speed of sending out this information. As I said to you, I'll just show you how WAHIS has served our members and served us through history. And currently, data is received by our network of 203 delegates and CVOs, who are not members, CVOs. And also, in addition, the focal points will actually assist in entering this information. The alert messages are sent every day as they are received. Within the 24 hours that they are received is an obligation to us. And from this graph, you can actually see that from I just picked the period 2013 to 2016, but the graph has been growing ever since 2005. We can see that the graphs for the follow-up reports, that is, these are the reports that show the evolution. The members are sent to the OIE to show the evolution of the disease events through the weekly period. They are seeing the importance of sending this information because of trade. They want to facilitate trade, which is the bottom line for us at the OIE. So you can see there's a significant growth there regarding disease submitted by our members and non-members. Data is not only received by the delegates and the focal points, the official part of the veterinary services. There's also a growing base of subscribers currently standing at 14,000 who receive these alerts on their mobile application, and also they have subscribed to receive through the email system all these alert messages so that they can know exactly what is happening, where, and what the disease events are happening. They also can access the same alert messages through going directly through their desktop systems on the internet, the WAHIS web interface. And this is receiving on an average 4,000 visits in a day. Though our World Animal Health was launched in 2016, within a year, we have seen tremendous access to this World Animal Health, which basically demonstrates to us the hunger that the users had out there of being able to have a tool that extracts information from the system and they can use it for whatever purpose they wish to do. So this basically shows that throughout the years, WAHIS has served its members and it has served us to meet our obligation on transparency, which is also one of the strategic objectives of the OIE. So you say, no, yes, you are showing us that WAHIS has done very well, but then you are saying you are upgrading it. If it's not broken, why do you fix it? So I just want to show you the reasons why over the years we have collected this type of information from the users, from the members, from the delegates, through all the meetings that we had, through all the interactions we had, on the reasons why they wanted the WAHIS to be upgraded. And quickly, the requests, I'll start with the members. They wanted WAHIS to be able to evolve with the changing standards. As they adopt new standards, they wanted to see WAHIS reflecting this change in the standards. The donors wanted information to see if they can access the data, manipulate it, and make decisions on which country to assist, which country needs assistance in what areas to factor and tailor-make all these technical assistance programs to the relevant member countries. Also, changing of societal behaviors. I've said they wanted information on the go, information everywhere they are. And again, as we've demonstrated during the general session and other meetings we have, we've shown that, for example, in the situation of lumpy skin disease, because of the changing environment, the vectors changing their host areas, this disease, for example, lumpy skin disease, is actually moving in the northern latitudes from the 2005, from 20 degrees north, now is at 40 degrees north. So this is an example of a changing environment of the disease threats, and as biodata has shown, these dynamics are important to be aware of. There's available technologies that WAHIS has to be able to go to and address, and people wanted something that is convenient, a system that is flexible and easy to enter information into. This is the information that we had. But before we went ahead, we said, let's engage our stakeholders. And we consulted our stakeholders through online questionnaires. We did 2 separate online questionnaires for internal users, those who enter the information and those who also access the interface. And the second questionnaire in April 2007, which was also online, was basically addressing those who use the interface aspect of it. These were 2 separate, and we had something like 1,000 respondents who I'll show you how they've prioritized what they wanted to see in the new WAHIS. And we also, before we started in 2016 April, we convened what we call a WAHIS think tank to be able to give us recommendations as the OIE how to embark on such a program, which is going to take a lot of resources and financial resources and human resources and time to say what are the best available technologies out there, what is the best methodologies to approach this project, and the technical issues, budgeting and human resources, security issues, storage issues. This WAHIS think tank came up with recommendations which we still apply up to today. And thanks for even WHO was a part of the think tank. Dr. Barbosa was there. And we will continue to do consultative meetings to look at the specialist areas, for example, in data mining, in storage and security, as the WAHIS team, even up to today. So we have basically engaged a lot of our stakeholders. Who are these stakeholders? And you will see that most of them were basically from the public sector, the animal health, the veterinary services and the public health, and in growing about 8% international and regional organizations. And you can see that the academia are a growing group of interested parties here that we should not leave behind. And the journalists and also the private sector and trading services are some of the stakeholders that provided us feedback. And the feedback was basically, we grouped what they said and what they prioritized from these 1,000 respondents. And basically they wanted to see a system that is evolving to the standards, as I said. They wanted to see something that was user-friendly and saves them time and has interoperability and other features that basically can assist them to make informed decision on risk analysis. So as we are upgrading the system, we've divided it into 3 phases. Phase 0 and phase 1 and phase 2. Phase 0 and phase 1 have already been completed. Some of the issues that I have mentioned, we've hired the company that was working with us to give us an ideas on how to go forward from the technical aspect. We have hired the project managers in the business part and the technical part, which are also working with us. We've done the stakeholders assessment. And currently from December, we will start building the new WAHIS. The other important part, which is optimization, which is actually part of phase 2 in the long run, is to do optimization of the system. Regarding issues of security and new features that will come, and we'll have to input them onto the system. So we are looking at the long term. We don't want to come back to you again in a very short period and ask you for financial resources again to do another WAHIS in the short term. We are looking at the long term. Where are we now? Basically, we've developed the business processes of how the whole thing is going to evolve, the creating of all these reports, and that is being available. This is going to lay the foundation of the companies that is going to be engaged to take all these business processes and develop business requirements and develop the system through the modular system, through the agile project development methodology, and from there on, give us the technical specifications of the system. So all this information, the business requirement is being completed and is available. I won't be doing justice if I don't talk about another specific area of the business processes, and which everybody likes to hear about, is interconnectivity. The new WAHIS, as I've said, it will have improved mappings and data mining features and an improved web interface, and it will be supported by a mobile application to receive data on the go. But for all those who are willing to interconnect or have some interoperability, whether at national level or our cooperating partners or at the regional level, they will need to access the system somehow. And this, we foresee it by developing an interface where they are going to connect. By this interface, it means whenever who's interested, we don't have to change anything on the major core WAHIS, which is going to be ready by 2019, May 2019, June 2019. So this, the partners willing to connect and the member countries willing to connect will have to use an interface. The others here, probably we are looking at the genomic platform, where we interconnect the genomic platform, which is big data, which is not going to be, information is going to be sitting in WAHIS, but it will sit in another platform connected into WAHIS to be able to support our members to make a disease traceability. A project like this one, basically we need to communicate not only with our member countries, our delegates and focal points, we also need to communicate with our partners out there. Communicate not the end product, but communicate throughout the steps that we are taking to the end. And to communicate for collaboration, to communicate for partnerships, and communicate for ownership, so that as we go along, they become part and parcel of the whole process and they see the system as theirs, and that will create sustainability. So this is an example of a brochure that we have developed, and the pictures basically show you that the idea is, in the end of the day, the farmer will have to see the reason why he has to give the information to the veterinary services, and the veterinary services to push it to WAHIS. So you're probably sitting there and asking yourself, what is in it for me? What are the outcomes? Why should I put money in this piggy bank? Basically, for the delegates, we foresee you having access to a tool that is data-driven, and your decision-making will be based on data that is officially available to you and has been validated. And we'll provide, for the IT people who are developers, people who want to interconnect with WAHIS, we'll provide a data model and web interfaces that are standardized and will give you access to publicly available OIE information. So interdisciplinary collaboration, we foresee a lot of interdisciplinary collaboration, and because it will also be a user-friendly system, we foresee a lot of users being able to access it. So what are the next steps? The next steps are now, as this week, last week, we sent out a request for proposal to the companies that responded to our international tender, call for tender. We sent them information regarding how they can provide us with the proposals. Looking at in December, January, they will start developing the system through modules. So by December, we foresee engaging this company, and in January, the latest, they have to start the development. We are also looking at engaging the WAHIS user group, which is going to work with us to validate and test all these features, new features, before launching the WAHIS core modules in May 2019. So that is basically quickly the next steps. So in concluding, Mr. Chairman, I will say WAHIS is an important source of global animal health information, officially provided information which is validated, and I've shown you how this system has grown over the years from 1927. And basically, by going and doing WAHIS Plus, this will provide us with an opportunity to enable cross-linkages with other relevant health systems to respond to the future challenges and the demands of our members, and respond to the biothreats, which is the theme of this meeting. So I challenge you and I request you to provide us with the resources, because thanks to the members that have already given us resources, to kickstart the program and do all the activities that I've shown you, we still need more resources to develop the system going forward. My fear sometimes is there's a lot of expectation from WAHIS, but at the same time, we have to balance that expectations with the core mandate of the organizations, what we need to do. So everything that the members are asking for, it costs money. So be part of this project. Thank you, Mr. Chairman. I'll thank the WAHIS team, which is back in Paris, that has worked hard and they are continuing to work hard in developing the system. They've also contributed to this presentation. Thank you very much.